Thank you for joining the 18th World Conference on Tobacco or Health webinar series. During today's webinar, we will discuss fiscal strategies for financing health services in pandemic times, the case for tobacco tax. Before we get started, I would like to go over a few features that will allow you to take part in today's event. When joining the webinar, you are prompted to set up your audio. By default, the platform selects your computer's mic and speakers. If you prefer joining over the phone, please select phone call in the audio pane and the dial-in information will be displayed. Please note that you are joining in a listen-only mode, which means that you are muted throughout the webinar. However, during our session, you will have the opportunity to engage with our panelists by submitting your text questions in the questions pane. You may send them at any time during the presentation. We will collect and address these questions during the Q&A segment at the end of our panelists' presentations. Without further ado, I am pleased to welcome our webinar moderator, Mr. Francis Thompson, who joined HealthBridge in 2007 after serving as a member of the HealthBridge board from 2002 to 2006. He has worked in tobacco control since 1996, first at InfoTabac in Montreal, then as policy analyst and later director of policy at the Non-Smokers' Rights Association in Ottawa. From 2007 to 2009, as part of HealthBridge's partnership with the International Union Against Tuberculosis and Lung Disease, Francis acted as regional advisor to the Union for Latin America with particular emphasis on Mexico and Brazil. He is the former executive director of Framework Convention Alliance, a global civil society alliance working to end the tobacco epidemic, including by promoting the WHO Framework Convention on Tobacco Control. Francis has served on the program or scientific committees of various tobacco control conferences, including the Canadian National Conference, the International Francophone Conference, and the World Conference on Tobacco or Health. Francis, over to you.
Yes, thank you very much. And as you probably realize, this webinar is organized by the Union and also by the 18th World Conference on Tobacco or Health track committees. As you know, the World Conference was supposed to be held in person in March of 2021, but has been postponed, and we're doing virtual events in the meantime. Today, we're going to be talking about money, public finances, which will be, I think, on everybody's minds as soon as the pandemic is finished. And we have two excellent panelists. Allow me to introduce them. So Dr. Susan Sparks and Dr. Frank Shalupka. So Dr. Sparks will be speaking first. She is a health economist on the health financing team at the World Health Organization headquarters in Geneva and has 15 years of experience in fiscal policy, health financing and health systems reform around the world with a range of organizations, including the World Bank, Global Fund, and USAID. And she's also widely published on health financing, political economy of reform, health systems, and universal health coverage. And Dr. Sparks has a doctorate in health economics from Harvard, a master's in economics from Tufts University, and a bachelor's in political economy from Georgetown University. And with that, I will pass it over to you, Susan.
Great. Thank you. Hopefully this is all working well. So I will start the presentation. But I also want to just thank the organizers for having me here, and I really look forward to the discussions and the questions and answers. So unless I hear otherwise, I'll assume that everything's okay with the presentation. So as background, I am a health economist on the health financing team, and that's my background. So I'll be speaking from the perspective of the macro fiscal impact on health financing, and also speaking in more detail on the issue related to earmarking of health taxes revenue, which of course includes tobacco taxation. So the first part of what I'll be speaking on relates to the economic, fiscal, and health financing implications of COVID-19. And then the second part is to the considerations of health taxes as a fiscal strategy for health financing and some of the nuances around some of those discussions. So first, what we know is that the COVID-19 health crisis is really mirrored by a deep economic crisis as well, that will have a long-lasting impact on health financing. As Francis just mentioned, once we get through this initial crisis phase related to the health part of this, the economic crisis is quite deep. And what I'll be presenting here now builds from work that was just released last week on the Global Spending on Health report, in case anybody wants to read in more detail. So just as background, what we know, and I think why we're talking about fiscal strategies right now in particular, is that COVID-19 has triggered a deep global economic contraction. So this graph is showing the GDP per capita growth rates. And so what you see in 2020 is this deep growth, or this deep spike downwards, which is a lot deeper than even the 2009 financial crisis. And then these are based on the IMF projections. But what we know is this is a very severe economic crisis, and it will take many years to rebound from. So even though the growth is projected to come back, it's going to come back from a lower starting point. So there's really a shift downwards in terms of where the global economy and country economies will be growing from. And that what's somewhat unique about this crisis is that the economic part of it is really hitting all countries. And so what you see here is the per capita GDP growth rate across income levels. And so even though the health impact is somewhat variable across regions and countries, the economic crisis is actually universal in relation to COVID-19. And so what does this mean actually for revenues? And so when we talk about fiscal, we're talking about government budget revenue. So how much money is there in the public purse? And what you see here is the annual GDP growth rate and tax growth rate for EU and OECD countries, but this is going to be mirrored across the world as well. And what you see again is this deep decline in the amount of revenues that governments are actually bringing into the public coffers. And so there's really going to be quite a severe budget crunch. And what we know is currently many governments or most governments are buffering that revenue decline as a result of the economic decline through taking on more debt, so through deficit spending. And so it's also what's important to note about this crisis is that countries are already starting out at a higher average level of debt going into the crisis. And so what that will mean are these are longer term fiscal obligations. So the debt servicing obligations will put pressure on all countries. And so I'm particularly speaking and thinking about low and middle income countries, but this is also the case for high income countries as well. So this is a bit sobering. Of course, it's the end of 2020, so I guess it's somewhat appropriate. But this is the picture of why these discussions around, okay, where is the money going to come from? What are the revenue generating prospects going into 2021 and beyond? And how does this in particular, so I'm on the health financing side. And so in particular, what does all of this mean, both the health and the economic crisis, in terms of health spending? So in terms of the amount of money that's available to spend on health care in individuals' health and population health as well. And so it's really this dual pressures that are going to be coming as we look into 2021. On the one side, on the demand side, we know, of course, the COVID-19 has added a huge amount of fiscal pressure in terms of demand for spending. But also, as we look into 2021, all these elective surgeries and the amount of disruptions to care that have happened as a result of COVID, those consequences are going to come. That pent-up demand will need to come back into the system. And then there's also the demand and the recognition that, okay, systems were not well prepared for this pandemic. And so what does it mean to then make those investments in health systems and population health? And then, of course, there's the COVID-19 vaccine rollout. But so you have this upward pressure that's going to be coming as a result of, on the demand side, but then more on the supply side, we're going to be having this downward pressure coming from the economic contraction, the decreasing foreign direct investment, trade, and remittances. What we see is increasing unemployment, increasing poverty, falling government revenues, debt service obligations, and potential tightening of external financing. And then, of course, one issue that we see when we're looking at health financing, we don't just look at the government spending on health. We also look at private spending on health, which a lot of times comes in the form of out-of-pocket payments. So when you pay at the point of delivery. And what we're concerned about is that we might actually see a decrease in out-of-pocket spending, but that might have more to do with foregone care and increasing poverty rather than actually increasing financial protection. So that's the scene that we're entering into as we go into 2021. And now, in thinking about the role of health taxes, including on tobacco products, of course, and their ability to generate revenues for financing health services. So the title of this webinar. And if there are any other economists on the call, the answer to this is, well, it depends on whether or not these taxes can actually help finance that part of the system. And so this schematic, I don't want to, please don't focus on all the details, but I think the point here is if you look at the bottom are really foundational investments. And so these are foundational for health security, for universal health coverage, and they include taxes and subsidies. And those taxes and subsidies are those taxes and subsidies that promote health. And so from a WHO perspective, that tobacco taxation, what we call health taxes, which includes sugary sweetened beverages, alcohol taxation, the primary objective of that is the health part. So improving population health, and really that this is part of a core part of the role of the state in the health system. So regardless of the country, it's the taxation power sits within the government. So this is fundamentally a public sector issue. So what we know is that, of course, there's a large health impact of these taxes, but also the revenue impact. And so there's this win-win, right? So you improve health through these taxes, but also you can increase government revenues quite substantially in some cases. And so these are some estimates from the Bloomberg Summers Task Force on Fiscal Policy for Health. But just to say that those two objectives are quite real and quite important, and why we're so pro-health tax, and also why it's being discussed in the context of this fiscal tightening in relation to COVID-19. And so this is an example at the country level. So here, if you look at the red line, this is in Ukraine. And so what you see here is the increase in the red line of tobacco excise revenue. And then the turquoise line, what you see is the actual decrease in the number of daily smokers. And so again, what you see is this at the global level, the dual impact on health and revenues, but it also plays out in country data as well. So now comes the question of, okay, if governments are now bringing these revenues into the public purse, how can they be allocated? What happens to them? What happens to this quote unquote health tax revenue? And so on the one side, you have, it can go into the general government budget, it can be pooled with other funds, it can fund unrelated public priorities. But on the other side, what you can tie it to more clearly to objectives by offsetting new burdens, and so compensating. So this is the case in the Philippines, where they introduced tobacco taxation, and a portion of the taxes are actually set aside for farmers and agricultural producers in the tobacco producing regions in the country. You can further the goal that you're trying to advance through the health tax. So this is the case of Thailand, where the tobacco tax revenues are then dedicated to the Thai Health Promotion Fund, which is in charge of public health education, including tobacco control measures. Or you can compensate people who bear the cost from the tax activity. And so, and this is a different form of trying to compensate and offset the burden of the tax on the people who are actually paying the tax. And so what we call this column and that's circled in purple, these are earmarks. And so this is what we typically refer to as earmarking. And so what I'm going to be speaking to for the next few minutes relates to work that we've done broadly looking at earmarking specific revenues for the health sector, not just from tobacco taxes or even health taxes, but then also complemented by work that colleagues of mine have led at WHO, looking specifically at the issue of earmarking tobacco taxes, because this question of earmarking comes up again and again and again, both whether it's in the health financing space or in the tobacco taxation space. So what both of these studies really look to do is say, okay, what's happening in practice? What is the actual experience with these mechanisms of this particular part of the tobacco tax and overall health tax conversation? And so generally speaking, what we know is that many countries earmark revenues for the health sector. So this is data from 2017. And at that time, most of the earmarking related to payroll taxes to pay for Social Security or health insurance. But then what we also see is that 24 countries earmarked a portion of tobacco taxes for the health sector of some kind, and 20 countries of alcohol revenues. And these are only increasing. And so this is a pervasive instrument. I think we should say that right up front. So now to think through some of the debate around earmarking. And so I come from an economics perspective, but so the public finance people, there's a tendency to think, well, okay, finance authorities, they don't want earmarking because that constrains their ability to allocate funds through the budgeting process. But then on the other side, you have a real advocacy of really trying to tie the revenues that come from this tax, in particular on health taxes, to a particular health priority. And so we wanted to move beyond the theoretical debate to really think about, okay, what are some of the pros and cons in practice? And what we found was that some of the pros and cons in the theory do play out in many circumstances, but there also are indeed pitfalls associated with earmarking, that it's not just a silver bullet type, that if you say, okay, I'm going to earmark, I'm going to introduce a tobacco tax, I'm going to earmark those revenues for a particular purpose, and voila, all the funding goes. And so what we know is that money is fungible. And so, and indeed, finance authorities are in charge of allocating general government revenues, even broadly, but then within the health sector as well, there's a pooling of funds that happens. And so what you see is that you might get an initial increase, but there can be an equal and proportional decrease in other sources of funds going in for that, whether it's the health sector or for a particular purpose. And then there's this misperception of adequate funding. Well, you say, well, this has an earmark, and so that must pay for that must pay for those services or for that priority, but really the revenue source, it doesn't really have much to do with the expenditure purpose or the expenditure need. And so it's not to say just because you have one revenue source that it's evenly matched to the priority that's needed in the actual budget. And that earmarked revenue can actually become a ceiling for the expenditure purpose. So from the finance perspective, okay, you have your revenue source, this is your money, but what happens if that need is greater than that earmark? And then also this potential of defunding other priorities within the budgeting process. And so what we saw was that countries really have different objectives for earmarking, and it's really important to recognize these. One is the revenue side, of course, overall revenues, which is very important, as well as for the specific programs or for the health sector. But what we also know, and what we saw really across the cases, is that there's a political power in terms of this earmarking story. And so introducing a tax is more introducing a tax and tying that revenue to something like social sector spending makes that tax more politically palatable, both from a personal voting perspective, but also in terms of the dynamic between health and finance, because what finance really cares about is let's increase the size of the pie. So we want that tax and those tax revenues, and they see that political value of tying it with the health sector as well. And so this is data from the tobacco tax that study that was done. And I think what I wanted to make the point here is that it's important not just to look at the revenues that come in isolation and relation. It's important to look at them in relation to the overall. So, and this is looking at tobacco tax earmarks in relation to general government expenditure on health, so the overall government budget for the health sector. But then also looking at what's the taxation capacity of the state in general. How much of that GDP is going into, what's the overall tax capacity going into the government budget? And so from a health sector perspective, and what we look at from a health financing side is how do we look at that overall pie and not just specific pieces of it. And so earmarking, does it work to increase net revenues for the expenditure purpose, whether it's a very narrow expenditure purpose or it's a broader expenditure purpose? So whether or not it's specifically for tobacco control measures or if it's for NCD care or, and so a lot of it depends on how the earmark is designed. Is it soft? Is it hard? Is it how tightly linked is the revenue source to the expenditure purpose? And this is really a case of the devil is in the details. And also that, and especially in low and middle income countries, what is the public financial management system like? How do those revenues come into the system and how can they then be directed to the needs and the services? And then ultimately budgeting is a political process. It's about matching funds to political priorities. And is the expenditure purpose that you're earmarking for, is that high on the political agenda of those in power? And then also thinking through the time horizon. So it's important to revisit these earmarks. So even when they're put into place, because needs can change on the population side. And so how do you then make sure that you adjust how much revenues are coming into the system? And so what we know is that COVID-19 is going to present an opportunity both for health taxes, but also potentially for the health sector in general to revamp itself and to really go into more of this, what we say, a building back better mentality. And so what we know is that they provide this health taxes and tobacco taxation can provide an opportunity for overall revenue. But that earmarking really needs to be handled with care, and the devil is in the detail in terms of that tax administration capacity. How does the budgeting process look? What is the nature of the earmark? And then more broadly for health financing, what we know due to this real macro fiscal crunch is that you're going to need proactive policy response that invests in these population-based, preventive, preparedness-oriented investments, and then thinking through the efficiency and really this prioritization of equity into the coming years. So thank you very much for the time, and I look forward to the Q&A portion of this. Thank you.
Thank you very much, Susan. And just a reminder that we'll be doing the questions after we've heard both presentations, and I do encourage people to put their questions in the question box. We'll try to go through them in order. Our next speaker, as you know, is Frank Shalupka. Dr. Shalupka, well, I don't think we actually need to introduce him at great length. If you work in tobacco control, you already know him. But Frank is a research professor at the University of Illinois at Chicago and director of the UIHC Health Policy Center. I think I won't read the rest of his biography, except to say that he works not just on tobacco, but also on alcohol, illicit drug use, diet, physical activity, obesity, and related outcomes. And he's going to be presenting a rather exciting new cigarette tax scorecard today, which I believe is available on the Tobacconomics website. And with that, I will turn it over to you, Frank. Run us through it. Thank you.
Great, thanks much, Francis. So Susan did, I think, a really nice job of laying out the win-win that we know happens with tobacco tax increases and with health taxes generally. But one of the things that we've also learned is that how these products are taxed is really going to have a big impact on what their health and revenue effects are. So part of what we've been doing is to try to get a better sense of how governments are doing with their tobacco taxes. And as Francis talked about, that's something that we are just releasing today, just went up on the Tobacconomics website, which is what we're calling a cigarette tax scorecard. And the idea here is to really look at how governments are using cigarette taxes, how they're taxing cigarettes, and whether or not they're getting everything that they can out of these taxes, both in terms of revenues and in terms of their health impacts. So what we're doing in the scorecard is focusing on different dimensions of cigarette taxes, looking at how effective they are in raising cigarette prices, how good they are at reducing the affordability of cigarettes over time, looking also at then the share of taxes and retail cigarette prices, which has been what most of the metrics have focused on to date, and then also looking at cigarette tax structure, given that that affects all of these different factors. In the scorecard, we're relying heavily on data that WHO collects and reports as part of its biennial reports on the global tobacco epidemic. So in the first release of the scorecard, we're using the most recent data from the 2019 report, as well as data from several of the past reports. And we construct scores for 2018, 2016, and 2014. This is something that we've been working on for quite a while at this point. It's gone through extensive peer review, a lot of input from people all around the world that's been very helpful in refining the approach that we're taking. And we're really relying on the recommendations that we get out of things like the guidelines for Article 6 of the WHO's Framework Convention, as well as a number of other sources that I'll highlight at least a few of as we go through this. So again, we're focusing on 4 key components. The first key component is going to be cigarette prices. One thing we know from the extensive research that's been done globally, hundreds of studies now from every part of the world, countries at every different income level, is that when cigarette taxes are increased, when prices are increased significantly, that we know that the taxes are the single most effective way for reducing tobacco use. So the first thing we're going to focus on in the scorecard is how well taxes are doing in raising prices. So here our key metric is going to be looking at the purchasing power parity adjusted price for the most sold brand of cigarettes. This is really going to allow us to account for differences in purchasing power across different countries at different income levels. And the scoring that we have there reflects basically different levels of prices. So countries that have prices that are at 10 international dollars or higher are going to get the highest score on this component of the index. And those that have prices that are less than $2 are going to get the lowest score, 0 points in terms of our scoring. If we look at what's happening around the world, we can see that on average, countries are just under about half of what the potential is on this metric. Our scale is, again, a 5-point scale. The average score here is just a little bit over 2. And you can see that most regions are not doing real well on this metric. The European region leads, followed closely by Southeast Asia and the Western Pacific. But again, there's still a lot of room for improvement, a lot of room to push prices higher with higher taxes. And then when you look at what's happening across countries at different income levels, you can see that there is some general relationship with income. with countries that are at higher income levels generally going to have higher taxes, higher prices. The second key metric is going to be how taxes and prices are affecting the affordability of cigarettes. And this really comes straight out of the guidelines for Article 6, talking about the need to increase taxes, increase prices in order to make tobacco products less affordable over time. And it's really that change in affordability that's going to drive down cigarette consumption, prevalence of tobacco use. So here we're looking again at changes in affordability, relying again on the WHO's data on the most sold brand of cigarettes and how affordability is changing over time. Given our efforts to try to construct this measure at different points in time, we're looking at changes in affordability over the past 6 years. And we're also making sure that any changes that we observe in affordability are happening because of increases in taxes, that they're not just being driven by reductions in income, for example, and that these are significant, statistically significant changes in affordability over time. So here again, the countries that are doing the best on this metric are going to have at least a 7.5% reduction in affordability on average over that 6-year period. Countries that have seen some reductions in affordability but with no tax increase are going to get a relatively low score. In countries where we see either no change in affordability or increased affordability are going to get the worst score. When we look at the scores on this metric, this is where countries are generally doing very poorly. What we've seen is that affordability is not going down significantly across most countries, across most regions in the world. You see a little bit better situation in the Eastern Mediterranean, followed by Europe, Southeast Asia, Western Pacific. But again, not much of an improvement in terms of reducing the affordability of cigarettes. And when we look across income levels, it's really the lower middle income countries that are doing worst on this metric, in part because incomes are growing rapidly and prices, taxes are not going up to reduce affordability. The third key metric is going to be the share of tax in cigarette prices. This is something that's been the most focused on metric over time. Here we're using two different measures. One comes out of the recommendations that we made in curbing the epidemic over 20 years ago, talking about tax accounting for at least 2/3 to 4/5 of retail prices. And this is really embedded in the scoring that's done in the Empower reports for countries that have total tax shares of 75% or more are going to be the countries that are at the highest level of achievement. But we also want to focus on excise taxes. We recognize that excise taxes are the ones that really differentiate the price of cigarettes, and that these are the ones that are going to have the biggest impacts on consumption. And here we rely on the recommendation that was made in the WHO's Technical Manual on Tobacco Tax Administration, which calls for excise taxes to account for at least 70% of the retail price of tobacco products. So here what we're doing is basically creating a metric that's an average of two different tax share scores. One that's going to be based on that total tax share. Countries with 75% or higher are going to get the highest scores, and then falling as the share is lower. And then the second part of that is going to be the excise tax share, looking at countries that have taxes at 70% or higher, excise tax shares, they're going to get the highest score, and again, falling as the tax share falls there. Here you can see that the European Union really, or the European region really stands out in terms of the tax share metric. This is largely driven by the EU's Tobacco Tax Directive, the fact that they set a minimum tax of 60%, excise tax of 60% of the weighted average retail price for cigarettes. You can see other regions are not doing as well, the African region doing worst. And again, a very clear gradient with income here, with high income countries generally having much higher tax shares than other countries. And then the last key component of this is going to be cigarette tax structure. One of the things that we've learned over time is that tax structures really have a significant impact on prices, and in particular on the variability in prices. And here again, we're relying on the recommendations that are made in the guidelines for Article 6. Talking about countries using relatively simple tax structures, relying on specific, uniform specific tax systems, or mixed excise systems with a minimum specific tax. So here we try to incorporate this again into our scoring. We're going to give the highest scores to countries that have a uniform specific excise tax on cigarettes that's automatically adjusted over time, or we're going to look at countries that have a mixed system that rely more on the specific tax components, also adjusting that specific tax over time, but then using the retail price as a basis for their ad valorem tax and specifying a minimum tax as well. And then you can see we have differences there. You get lower points if you have a uniform system or a mixed system, but don't have these other features to it. And then at the bottom, you get no points for having no excise tax at all, which a number of countries still do. So here, if we look around the world at what's happening, we see again, countries are doing a little bit better on this metric than on most of the others. We see in the European region and also in the Americas that we have relatively high scores. Again, the relatively high score in the European region is given because it's due to the tobacco tax directive. And in the Americas, what we generally see is more countries that rely on these uniform specific taxes. So in the end, what we do is take these 4 components, take the average score across all these individual components to come up with our total score. And when you look around the world, you can see that there's quite a bit of variability. The darker a country's color is on this map, the higher their score is on this overall index. And what you see is countries that are lighter and lighter are going to be doing worse and worse on the index. If we look at the scores globally, you can see a few things that pop out. One is that on average, countries are not doing as well as they could. The global average score is just over 2, which suggests that there's a lot of room for improvement in how countries are taxing cigarettes. Again, you can see some regional variation. The European region doing somewhat better. The Americas, Western Pacific doing a little bit worse than that. But again, a lot of room for improvements in pretty much every region in the world. And same thing when you start to look across income levels. As income goes up, countries are generally doing better. But again, no group of countries based on income is doing particularly well. All have significant room for improvement. If we look at the top scoring countries on this index, the 2 highest scoring countries are Australia and New Zealand at 4.625 on our 5-point scale. And they do very well across all the different components. They both rely on uniform specific taxes that are automatically adjusted in Australia based on wage growth, in New Zealand based on inflation. They've been able to implement significant tax increases on top of those regular tax increases so that they can get significant reductions in affordability. And as a result, the tax shares are high and cigarette prices are high in these countries. If you go to the other end of the spectrum, what you see is countries like Iraq and Afghanistan and Libya are scoring 0 or just above 0, so not doing very well at all. If we look at what's been happening over time, what we see is that there's been modest improvements from 2014 to 2018, but it's really a mix of 2 different things happening. About half the countries that we're able to look at the data for have seen some improvement in their scores, fairly significant improvement in their scores, but that's counterbalanced by the fact that about a quarter of the countries in the data have seen reductions in their scores. So again, there's been some improvement, but it's been relatively modest. If we look at the countries where the biggest improvements have happened, you see a few of the Middle Eastern countries, Bahrain, Saudi Arabia, the United Arab Emirates, that have had significant improvements, largely because they've went from relying on import duties to implementing a significant cigarette tax in those countries. And then in Kyrgyzstan and the Philippines, what we see is also considerable improvement. And that's largely been the result of simplifications in what used to be complex tax structures, as well as on significant increases in taxes and prices. So just to wrap up, a few comments on limitations. One of the things that we're really limited by is that we don't have good information on the effectiveness of tax administration. So what you'll see when you look at the overall scores across different countries is there are some countries that score relatively well on our scorecard, but we know that they have significant problems with illicit trade in tobacco products, and that's going to limit the effectiveness of their tax. We also focus only on manufactured cigarettes, given the data that are available. We hope to be able to expand to other tobacco products as additional data become available over time. so that we can get a better sense of what's happening overall with tobacco taxes. We're also limited to looking at data on the most sold brand of cigarettes, so may not be capturing everything that's available in the markets. And again, part of this all then comes back to how the industry prices its products, its own pricing strategies. And then the final key limitation is that the thresholds that we set are somewhat arbitrary, in part driven, again, by some of the recommendations that I talked about, in part driven by the distribution of data across countries. But you would see somewhat different scores, although relative scores wouldn't change much if those thresholds were changed. So just to wrap this up, as I've been saying, there's considerable untapped potential of cigarette taxes at this point to reduce tobacco use, to generate revenues. Most countries are scoring less than 2 out of 5 points on our 5-point scale, and we've seen relatively little improvement over time. So just tying this back to the theme of the webinar, improving cigarette taxes is really particularly relevant during this time. Governments can strengthen their cigarette tax systems that would generate significant increases in prices, reduce tobacco use and the burden it imposes on health systems, and at the same time raise considerable revenues for economic recovery. So a quick whirlwind tour of the Tax Scorecard. You can find a lot more on our website, including all the data that went into this, the overall reports. And now I think we have some time for discussion. Thank you.
Yes, thank you very much, Frank. And I don't know if Susan, you want to turn on your webcam as well. Yes, so listen, we have questions coming in here through the question box. And I noticed that most people have skipped directly to fairly specific questions about cigarette taxes. But before we get into those kind of things, I want to go back to the original sort of broad topic of this webinar and just ask, maybe Susan, you can start on this, and then Frank might also want to say something, which is just a question of scale. So the needs for governments in terms of money are very, very large in terms of revenue. And cigarette tax is often seen as a kind of a nice to have extra little small thing. So do governments, in particular finance ministries, actually have sort of the bandwidth to think about that when they're sort of facing an immediate cash crunch? Or are they going to go straight to just thinking about VAT and income tax and that sort of thing?
Yeah, I mean, I think that's why we're having so many of these conversations right now. I mean, the World Bank has been having these conversations and these discussions, the OECD, and to really make sure this particular tax instrument is on the table as part of those discussions, because of course, it's important from a finance side, but it's also really important from a health side. And so there's cause to think that this might be more of on the agenda, because what we see are the comorbidities associated with COVID, that COVID isn't just COVID, it's also COVID and comorbidities. And so there's a really important linkage there to make both to finance in terms of, well, this can, the marginal revenue increase might look relatively small, but you also have to look at the preventive side. On the health side, what are the healthcare cost savings? And so I think that's why many of us in our community are hopeful that this instrument is really something that's important on political agendas, both from a revenue and a health side.
Sure. Frank, do you want to comment?
Yeah, I was just going to add to that. I mean, one of the things that we see is that, these are taxes that can generate immediate revenues for governments in a way that some of the other taxes may take longer to generate those revenues. And the consumption of these products, particularly tobacco, is remarkably resilient, and if anything, rises during these types of crises. So, this is an area where revenues can be particularly stable, particularly predictable, and it's an easy target at this point.
Do we have any immediate evidence of governments already raising tobacco taxes, sort of more so than usual?
I wish we did. I mean, at this point, I know that there are countries that are talking about it as a way of generating some revenues to deal with the economic crisis, but it's not something that I think has been widespread at this point. I mean, maybe Susan has some better information than I do, but I haven't seen all countries.
Yeah, no, I'm not an expert on this, but I know that, and others as well, that the government of India had been looking at how to get some of the tobacco tax revenues for the COVID response. And so, again, that's on some of the nuance around the earmarking side. But I think also just I think as I was showing, the other revenue sources are not going to be there for the short term. And so I think also being wide-eyed about that payroll taxes, income taxes, VAT, I mean, those are really, these are limited for the time being because of the nature of this particular crisis as well.
Yeah, fair enough. Okay, so let's go to a few of the questions that came through via the question box. The one which I suspect Frank is the one to answer this one, which is a question about why are we taxing consumers rather than advocating for governments to apply a high tax scheme prioritizing unhealthy industries? So I assume that's referring to some kind of corporate income tax or profit tax. So Frank, do you want to comment on that one?
Sure. I think, again, we're looking at trying to achieve two objectives with these taxes. One is to generate revenues, so they're going to be very effective at that. But the second part is going to be to try to improve behavior, to try to reduce unhealthy behaviors. And again, as Susan pointed out, as we know from the evidence across the world, these are very effective taxes in changing consumer behavior in a way that is going to reduce NCDs, reduce some of these burdens on health systems, some of the comorbidities that go along with COVID as well. So I think that's why we focus on taxing the products rather than taxing the industries.
Okay. All right. Had a question then about affordability. I don't actually know if the panelists can see the questions as well, or is it just me? Okay. So the question was the following. A question for Frank. If I understand correctly, your coverage of affordability. It seems as if it might be harder for those countries that already have high tobacco taxes to score highly on that particular measure. Can I ask you to clarify if I've understood that correctly, please?
It will be harder for countries to score high, but it's not impossible for them to score highly on that measure. And again, if you look at the countries that do the best in the overall scorecard, you see countries like Australia, New Zealand at the top, even though they have very, very, very high taxes, very high prices. But they do have these regular tax increases that they've implemented over the last 7 or 8 years, I think, which have been able to push down affordability. So it's not impossible for them to achieve significant reductions in affordability despite already having high taxes and prices. Okay.
All right. We also had a question from a number of questions actually from Bangladesh. I'll go with the one that seems most obvious. So in a country like Bangladesh, where there is a multi-tiered ad valorem tobacco tax structure, how do you actually increase tax revenue?
So the simplest way to start in Bangladesh would be to significantly simplify the system. So move away from that multi-tier structure. And that will likely be something that takes time. But starting by implementing a specific tax that's consistent across the different tiers, gradually reducing those differences in the ad valorem rates that are applied across tiers, continuing to raise the specific tax over time, getting to basically where the Philippines ended up, where you have a high uniform specific tax that's regularly adjusted over time. So something that Bangladesh could achieve if they really put their mind to it.
Right. Okay, and we also had a question from India about BD taxation. And for those who don't know India very well, BDs are sort of hand-rolled, they're not quite cigarettes, but they're smoked. There's obviously huge revenue potential there by increasing the tax. And the question is there not some way to actually make it obligatory for parties to the FCTC to have high uniform taxes?
That's something that was at the heart of, I think, the discussions over the guidelines for Article 6. The guidelines recognize that countries have sovereignty over their tax systems, so they can provide recommendations. They can't mandate that governments do different things. But when it comes to things like BDs, the same applies. The same basic principles that I talked about that enter into the scorecard. And in the guidelines, the recommendation is that tax all tobacco products similarly. So BD should be taxed at rates that are comparable to the rates that are applied to cigarettes. In India, you have a very complicated cigarette tax structure with different rates on different products based on length and other factors. So again, unifying the system, creating a uniform specific tax across the different types of cigarettes would be a good step in that direction. So the FCTC can't mandate that governments do things with tax. It can only recommend. The recommendations, I think, are pretty clear.
Okay. Interesting question from Ireland. Is there evidence that a multi-annual tobacco excise commitment from government, something like saying we're going to raise the tax every year for 3 years, that actually contributes to consumer cessation if you just compare it, say, with annual increases without any particular future commitment. So is mentioning a target, does that have any effect on consumer behavior?
Yeah, one of the things that I've spent some time looking at is the economics of addiction. And one of the arguments that we make there is that anticipated increases in prices are going to have bigger effects in the long term. Consumers are going to start to respond to those before the price increase actually takes effect. So when you have these sort of announcements like they do in Australia and New Zealand, where they're going to increase their taxes by X% every year for the next 3 or 4 years, what you see is consumers are responding to the overall increase initially. So you do get the benefit of the additional increases, but you also get people anticipating the future increases and responding to those by trying to change their behavior now.
All right. The question to do with long-term healthcare workers, care workers, which I assume are, obviously in the news a lot, and I think at least in North America and Europe tend to have quite high smoking rates and quite high death rates from smoking-caused disease. And the question is what information might help taxes or other measures cut their high rates, specifically for that population. I don't know if anybody has a great idea on that. I'm not sure that long-term healthcare workers are that different from the rest of the population.
Yeah, the two economists, right?
Yeah.
Right.
Taxation.
Yeah, not.
Go, Frank.
Go ahead, Susan.
No, okay.
All right, and then we have a next one here. Should smokeless tobacco products be taxed less as health harms are lower? A topic I think, Frank, you may have had some writings about in the past.
So, yeah, I mean, I've written about the idea of differential taxation based on relative harms, with the idea being to tax the most harmful products at the highest rates, tax less harmful products at lower rates, but still significant enough taxes to really discourage people from taking up the use of those products, with the differential promoting substitution to less harmful products. I don't know if I'd agree with the basic premise that smokeless products are less harmful than smoke products at this point. I think we need a lot more evidence before we can really say something about what the relative risks of different products are, particularly when you have a lot of these emerging products like heated tobacco products, vaping products coming to the market. So I think until you have really good evidence about what the relative harms are, I think that principle in the guidelines of taxing all products similarly makes a lot of sense. And once we do have better evidence about what the long-term consequences, relative consequences of consumption of different products are, then we can get into these discussions about differential taxation, but I don't think we're there yet.
Okay. Another question from India, which is a really basic question, but I guess goes to the question of how the report card is done, which is in cases where products are incredibly cheap, which is the case of quite a number of products in India, it doesn't take a lot to make them a lot less affordable. So does the report card kind of deal with that, which is that a multiple of a very small number is still a pretty small number?
Well, that's, I think, part of why we want to have this multi-component index to really try to capture these different issues. So, you can have high tax share, for example, but still have relatively cheap products available. So that's why we look at the overall price. And I think the same thing is going to be true when it comes to the affordability. So small tax increases on something where there's a low price can look like significant reductions in affordability. So that component they're going to score well on, but then they're going to still fall short when it comes to the overall price measure. In a country like India, they're going to come up short when it comes to the tax structure measure, and also probably with tax share as well. So that's the idea behind looking at this more comprehensive measure of what's going on with taxes, because one measure by itself isn't going to fully capture everything.
Okay. All right, listen, we're getting close to time. I wanted to get both of you, I'm going to put you on the spot here, and maybe we can start with Susan. If you're recommending somebody who's going to have, a minute with a finance minister in 6 months' time, what should they be telling them about cigarette taxes? What's the elevator pitch?
For me, the elevator pitch is that COVID-19 has showed that that prevention is really important, and that the health and the economic well-being of of societies depends in large part on the health of those societies and how well protected that health is. Because as we're seeing with COVID-19, that without those foundational investments, and so really thinking through not just on the taxation structure side, but also the population services and making sure that that care is available. So looking at this more comprehensive picture of health, and that taxes are a really important mechanism that are a win for health, but also a real win for revenues in terms of the overall government budget. And so, and that this is really the entry point for the Ministry of Finance to be really out front in terms of supporting health in a very proactive way. So that would be, I would start with the health side.
Okay,
and
Frank.
go with the revenue.
Frank,
I would just add. Yeah, I would just add one more win. So I think, Susan's hit the key win-win in terms of the health impacts, in terms of the revenue impacts. But I think the other thing is going to be in a time of economic and health crisis like we're dealing with right now, that there's also going to be this win in terms of public support that you're not going to see for other taxes. These are going to be taxes that are going to be very effective in generating revenues. They're going to be better than things like income taxes, value-added taxes, and doing that. And again, given the health focus of it, I think it's going to be something that people are going to be more willing to get behind. So I think a win-win-win in this case.
Right. All right. Well, this has been great, and I want to thank both of you for taking the time preparing all these slides, and in the case of Frank, making the scorecard available. This is, of course, a lead up to Leadership Summit that we'll be hearing about, I think, in a second. And we certainly hope that there will be more discussion about the fiscal aspects of tobacco control at that event. And with that, I will turn back to Joanna to finish off the webinar. Thank you.
Thanks, Francis.
Thank you.
Thank you, Francis, and or our panelists. Thank you all for attending our webinar today, organized by the Union and the 18th WCTOH Scientific and Track Committees. At the end of the session, you will receive a survey. Please don't hesitate to complete it because your feedback is important to us. The recording of the webinar will be available on the Union YouTube channel. Registrants will receive an email with the link. You can review the Tobacconomics Cigarette Tax Scorecard and the scoring data on the website tobacconomics.org. The Leadership Summit on Tobacco Control registration will open in January 2021. Don't forget to visit our website, wctoh.org, and register to our newsletter to stay updated on our various activities. Thank you all.